Hans-Ulrich Prokosch, as a CIO of a big German university hospital, how important is the field of big data or advanced analytic from a hospital perspective?
First of all, I would like to distinguish between the term big data, which is a very ambiguous term anyway, and the analytics part of it. Because in the hospital we have dealt with large volumes of data for a long time already with our PACS systems. What is today much more important is that we really look at the variety of data coming from different sources. And as a CIO of the university hospital, I always have to take care not only on clinical care but also on the clinical research and basic researchers. And for this purpose, the variety of data sources coming together and the need to integrate them and semantically annotate them is the first challenge for us in order to use such big data.
Can you specify that a little? How can big data be used in clinical research? Or how is it being used at Erlangen University Hospital?
Currently, the first approach is to use all the data in the electronic health records for clinical research support is mainly focusing on feasibility studies or on patient recruitment and clinical trials. In the next step, and we have just established a small platform for this, we are also integrating genomics and molecular data from high throughput analysis and links this data with phenotype data from our clinical records in order to allow the basic researchers to gain some insight in their data.
How are researchers reacting to this kind of offers? Are they using it actually?
Yes, but you really have to come to them and show them the systems, because when we first went to our basic researchers, they had actually no idea what type of phenotypic data were available in the hospital information system already. When we showed them how we could integrate such data with their molecular data, they were fascinated and they started playing around with such tools very much. And the next step was that they talked with their clinicians in their own clinics who didn't tell them before what was documented in routine care, and told them, well, give me just this one more item. If you just add this to some assessment forms, it would be much more helpful to integrate it with our research data. So it's starting to get used.
What is the vision? What are the next steps with the perspective of 2 or 3 years that you could imagine new tools to develop?
It's very important to have a better insight into all the data items which are actually stored and documented within the hospital environment. In our hospital we have much more than 1,000 forms with about 50,000 data items, but nobody knows anymore which data item is stored in which form, because it has been developed over a decade by several programmers, and what we actually need is a semantic network, some kind of semantic data dictionary to much more easily find data items when you need it for research purposes. And the next step will then be to annotate and integrate it with the molecular data. And if I have the vision for the next 5 years, we have to come to some issue which is called by other researchers exposome informatics, that we also integrate data from sources like social media or climate data or pollution data, all the data which persons themselves currently start to collect with small gadgets like an iWatch or tracking a wristband. That all those data need to be integrated and then linked to gain new knowledge.
Could you imagine to use some of the tools that you described for clinical care as well, so outside of research?
Well, the feedback loop should always be to clinical care. So as soon as you gain knowledge in research, you should try to implement those in your clinical environment so that you can directly support with a new research experience. You can support the clinician in the diagnostic or therapeutic processes. But that's the final cycle.
Thank you very much.